It's like having your mind broken into a million pieces.
It is quite frightening, debilitating.
I became mute. Literally, I declined within 12 hours so drastically I couldn't move.
I felt like the world was against me.
I had a pattern. I'd be well, I'd go to work, I'd not take my medication, I'd see some professionals and end up in hospital.
There is a set of things that will help to be integral to your recovery. For me, it was exercise, which helped with endorphins and serotonin, but also it was work, hobbies, things that kept my mind busy. That helped to reduce the noise with schizophrenia.
If you haven't got accommodation, your world crumbles really. And I've been without accommodation on several accounts.
Most people find themselves in debt through no fault of their own.
Without any services, I'll be in the crisis house every other week. I'll be wandering around, with no friend, no companion, no associates.
Service users will have access to a much larger mental health care team, a much more responsive mental health care team, and they've also been key in designing these services.
So you'll be seen much quicker than currently because we'll have increased number of mental health professionals available.
We are hoping to actually make every contact count. So every opportunity that we actually have for that particular patient, they'll be able to actually resolve quite a few of their needs.
It involves people that work with service users coming very closely together, forming much tighter links. So that means you might not have to repeat your story. You're working with people that are focused on a small area, so they'll have an expertise around the area that you live in. They'll be aware of the support that's out there.
This way we can address things with regards to physical health, mental health, general well-being, so that it allows you to have care within the community at the right time, at the right place.
As someone with lived experience, we tend to support people with mental illnesses, both emotionally and in an advocacy way, try to counsel them, point them in the right direction for them to improve their quality of life. We may signpost them to different organisations.
You also are providing a sense of hope to a lot of new service users who will find the experience confusing, traumatic, scary, isolating.
We'll also be working much more in partnership with our local voluntary sector colleagues, so there'll be much more access to local community grassroots organisations.
Our services are embedded within community centres, allowing people to access services in the comfort of their own communities, in their own language and their own cultural backgrounds, and being very reflective of their needs, so that people are then able to receive support when and as they need it. We make them very language and faith-based and cultural-based, so that people feel that they are understood and that services are very tailor-made to what their experiences reflect.
I think it's vital to have service users' views, because they often think of things that the professionals don't, whereas we think outside the box.
It's really about their involvement, them driving the vision of what they want services and support to look like.
The services will be rolled out over the next 3 years and will be in constant consultation with service users and providers within the community. They will be really designed so that they can reflect the need of the population.
the trick is to never think that I'm alone, and that there are resources everywhere to help me. There is there's strength in being vulnerable, there's strength in vulnerability. Asking for help, not to be embarrassed to ask for help. Yeah, and I say keep smiling, keep shining.